Hi, can you hear me?
Hi, yep, I can hear you.
Perfect. I'm going to give a couple of more minutes to other attendees. I know people are probably either in their commute or finishing dinner or whatever might
Sure.
be. Are you okay if we record our session so we can share?
Yep, no problem.
Excellent. Where are you located?
We're in Southborough.
Okay, gotcha.
Yep.
Very good. And has your pet had surgery yet or
He
something is
has. We are
okay?
last Thursday, so we're kind of 5 days
Oh
post-op.
boy. Yeah. So did you sleep at all?
Not particularly.
Yeah, the first few days are not easy, that's for
Yeah,
sure.
they're tough. Yep. This is
They
our
are,
second one, so we kind of
oh
anticipated it, but
gosh.
it doesn't get easier.
No, it doesn't. I mean, I
Yeah.
think you're better prepared, maybe, but at the same time, it's not easy, you know.
Yeah. I think you're
Yeah.
mentally better prepared, but otherwise
Yes,
it's the same. Yeah.
it is. It is. And I think you're maybe I think sometimes the second time around we're a little more impatient
Yeah.
because we're, hoping to get through that really tough stuff. Yeah. So hopefully, I mean, you're close to the end of the first week, so that's good. So yeah, so Dan just joined us too. We have a few others that we're expecting. And I'll certainly, hang around at the end so that we can have any discussion or Q&A, but feel free to like throw notes in the chat if you have specific questions or even interrupt me along the way. So I'm perfectly content with that. And Dan, feel free to, either mute or unmute yourself, or if you have any questions off the bat. I'm just giving everyone a few minutes to join us. Hoping that everyone was able to get the correct link. Where are you joining us from, Dan?
I'm in Worcester and stuff.
Okay.
I guess Donna had an appointment that she forgot about. Otherwise, she'd be here too. But
Oh no.
at least one
Well,
of
I'm
us.
I'm recording as long as you're okay with that, and I'll share a link to the recording with you guys. So yeah, so if you want to share with her after the fact or take notes or whatever works best for you. So and has your pet had surgery yet, or are you considering surgery, or where are you in the process?
No, well, she's scheduled for the 22nd
Okay.
to do the one that's bad now, and then I guess we're gonna do the other one uh,
Yeah.
in a while.
Yeah, and Ekta's in that position where she's already had post-op number 2, so you're just beginning the process. Unfortunately, it's incredibly common for them to have both of them done. Um, yeah, it's not a fun process, but I think if you're better prepared, it certainly makes it a little easier, maybe a little more predictable. So that's really why we tried to get this going, to give you an opportunity to ask questions beforehand during the process and to try to understand a little bit better the process. The surgeons and nurses tend to be more focused on the medical side, the actual procedure, the medications, not a lot of focus on the rehab that's involved. But that's really our topic today, to kind of give you a little, I guess, preparation, and then as well, maybe some tools to help you along and make, the first week and the first, month or two a little easier for all of you. So I appreciate you joining us. I think we may have a few more joining us as time goes on, and that's totally fine. I'll just kind of let them enter the Zoom room, and let me know if you have any difficulty, seeing what I'm sharing with you or hearing what I'm saying, or if you need me to clarify along the way. I'm using kind of a closed captioning for the first time. So I'm sometimes afraid to do that because who knows how it's going to interpret what I say. So hopefully that won't be too much of a distraction. But let's go ahead and move on, because I know your time is valuable, and you know, we can maybe enjoy kind of winding down our day a little bit here. So our topic today is really to talk about the rehab and physical therapy component after cruciate ligament surgery. So I think some owners will join us whose pet is not having a knee surgery, but maybe having another type of orthopedic surgery, which is completely fine, because really a lot of the preparation is very similar. You know, but the rehab and the recovery is different for every pet, you know, so we're going to give you the best case scenario, maybe the worst case scenario, and you know, and hopefully we fall somewhere in between, or closer to the best case scenario, you know, giving you a little bit of knowledge and information ahead of the actual procedure. So you know, the reason I put this together, and you know, and have collaborated with the surgical staff at Boston West, is that, you know, I found that regardless of how long we've been doing this procedure, and how long pets have had surgery, and how long we've been rehabbing them, we all have questions. We have questions about the process. We have questions about the anatomy, about the injury, about the surgery itself, and asking questions and getting answers, getting different perspectives can really, you know, help us to help our pets even more in that post-op period of time. So let's talk a little bit about the anatomy of the knee or the stifle. So I like to use kind of human terms, because I think it's easier if we make a parallel or a comparison to our own anatomy. I'm actually trained as a physical therapist, so I started working with people before I started working with pets and their owners. And so some of the terms are different, some are very similar. Obviously, the orientation of the pet being on all fours rather than on 2 feet changes a lot of the physics and the biomechanics that's involved in this rehab, recovery, and the surgery. So the ACL, or anterior cruciate ligament, is called the cranial cruciate ligament in the dog, and that's just based on how it's oriented in space, excuse me, and relative to gravity. So it connects the 2 bones of the lower leg, the femur, which is the thigh bone, and the tibia, which is the shin bone. And the purpose of the cruciate ligament is to limit rotation and hyperextension in the knee. So when people have this injury, when they rupture, they tear, or they strain this ligament, many times it's a traumatic injury. Many times it's due to sports. So you hear about this with football players, with soccer players. You know, many times it's with some type of concussive or traumatic force, in which the person is hit from the side or they're hit from the front and they're twisting on a planted foot. In the dog and even in the cat, it's less of a traumatic injury and it's more of a chronic injury. So it's more of an overuse injury. And we're finding that it's actually related to their conformation, but it also could be related to their activity, their body weight, breeding, their diet, you know, hormones. There's so many different reasons for failure of this ligament. And unfortunately, it can be a fairly disabling injury. Fortunately, we do have surgery to help to repair the injury and get the pet back on all 4 feet again, all 4 paws again. So when you first take your pet to the vet, and they're limping, maybe just on 3 legs or having difficulty walking, likely they're going to do a hands-on evaluation and probably an x-ray. So that B picture, or that middle picture, is actually an x-ray or a radiograph of the stifle or of the knee. This is from the lateral side, so from the outside of the leg. And what you'll see here is the femur coming down, the patella or the kneecap, and then the tibia or that shin bone. You can't visualize ligaments on a radiograph, but you can see changes on the radiograph based on that ligament being ruptured. So many times vets will see maybe a little more of a pocketing of inflammation in the front of the knee, kind of in that triangular space. They may see more inflammation in the back of the knee. They may also see some thickening of the patellar tendon in the front. And finally, they might see a shifting of the bones there that indicate some instability in the knee. So usually it's diagnosed with a hands-on evaluation and secondarily with a radiographic evaluation. Sometimes a general practitioner or family vet will actually send you to a surgeon or a specialist first before they even do radiographs, because likely the surgeon is going to want to do another set of radiographs so that they can prepare for surgery. The first picture is actually a picture of an arthroscopy. So we're actually seeing what we call fibrillation, or we're seeing some damage to the ligament and even to the cartilage in there. We're seeing inflammation, and you can actually see blood vessels kind of growing into that area because of that inflammation. And then that third picture is a musculoskeletal ultrasound, where we actually see changes to the ligament structure. So the ultrasound and the arthroscopy are less used for diagnostics, but they can be as well. So if we think about the ligament and what it does for the knee, what it does for the stifle is it keeps the train on the track. And your surgeon may have talked to you about your pet's knee and having to kind of change the level of the tibia. So that tibial leveling osteotomy or tibial plateau leveling osteotomy means that they're taking that bottom bone and they're changing the orientation there so that the train can stay on the track. So it puts less stress on the knee, on the stifle, on the ligaments within the stifle, and there's less instability of the knee as the pet is weight bearing. Some pets have an orientation where the train is going down the track and that creates instability. Others have a kind of a steeper angle the other way. The train again is going off the track and the femur is moving back on the tibia. So both of those can be problematic for the pet to weight bear, and both can lead to changes in the joint and earlier osteoarthritis. So this is really the primary reason that surgery is a recommendation for these pets, because they have instability at the knee, because they have inflammation from either chronic injury or chronic instability. Osteoarthritis develops early, and it can develop very early, even in a young pet. And so the hope is to restore stability of the joint so that our osteoarthritis progresses more slowly, where we kind of catch it and halt it through the process. Pets that are stuck in this inflammatory stage or with instability, they don't move normally. They stress out other muscles, joints, ligaments, etc. They might stress their backs, and that might lead to other injuries in other parts of the body. So there are many, probably hundreds of different surgical options for cruciate ligament rupture. The first is what we call an extracapsular or a lateral suture. It's basically taking like a fishing wire, sometimes made out of like a plastic, other times made out of a very, very strong microfilament. And we basically put that in through bone tunnels and anchors and create kind of a prosthetic ligament with that suture material. The second procedure that's very, very common is the TPLO, or the tibial plateau leveling osteotomy. What happens here is that the surgeon creates kind of two little holes in the tibia. They place this kind of brace on here, this jig, so that they cut appropriately or at the right angle. They make that cut in the bone. They actually create a fracture. They create an osteotomy. They rotate the bone. And then once the bone is rotated in an appropriate position, they place a plate and screws into that plate to hold it securely. Then they take the jig off. take those placement screws out, and you're left with kind of that plate and those screws into the tibia. The fortunate thing is that plate is actually on the inside of the knee, so it's less likely to have trauma to it, kind of bumping on the lateral or outside of the knee. It's not as obvious, but I will guarantee that the dog's knee will look different after surgery, and you can feel that plate underneath the skin on the inside of the knee over time. Some pets will have the plate removed over time if they have a reaction or if they have a problem, for example, an infection underneath the plate. This is fairly rare. I'd say in probably less than 25% of patients that I've seen have had that plate removed. Many of them live a long life, and the plate remains in place for life. That third picture is a procedure that is maybe less common now, but was popular maybe 5 or 10 years ago. This is called a TTA, or a tibial tuberosity advancement, in which there's another cut that's made in the tibia, but it's made kind of down through the bone. That attachment site for the patellar tendon or the quadriceps tendon is moved forward. So this effectively actually makes that tibial plateau longer. So it creates more stability by creating a bigger base of support. There's a cage that's placed to kind of create some space here. Eventually the bone fills in and heals. And there's another kind of plate that's placed on that osteotomy site with screws. So, surgery is a big deal, and this is an orthopedic surgery. It's an elective surgery, you could say, but in actuality, it's very effective, and it's fairly important, I think, for their quality of life, especially a younger dog, an active dog, and one that you want to return to normal activity again. But there are some pets who may be older, you may have other medical issues, maybe for financial reasons or other issues, may require a conservative route. And this is an option. We can do bracing, we can do rehabilitation, we can use medications and injections to make the pet as comfortable as possible and help them to use the leg as well as they possibly can. Just like surgery, these are not without issues or concerns or potential side effects. Certainly, putting a brace on a leg and doing rehabilitation, may cost as much long-term as the actual surgical procedure does. Many of these pets do go on to develop osteoarthritis, and may have an impaired quality of life because of that, but with support of their veterinary staff, they do actually fairly well. So many of us may have torn our cruciate ligaments and not had surgery. We hear about athletes who have surgery, or we see athletes who are wearing braces. Why does our pet need cruciate ligament surgery and sometimes we do not? So if you think about the actual anatomy or the physics of weight bearing and using a leg, when a dog is standing, they actually stand with the leg in a flexed position. So the hip is flexed, the knee or the stifle is flexed, and then the heel or the calcaneus, the ankle joint, is flexed as well. When we're standing, we usually stand in extension. So the hip is extended or straight, the knee is extended or straight, and the ankle is kind of locked out. So when our pets are standing, they're actually standing like they're wearing high heels. So there's a bit of instability already, and that cruciate ligament is actually imperative and very important for the use of their leg, as they walk, as they trot, as they run and play. So, really my goals for you, through this session are to kind of get you in the mindset of preparation. So preparing not just your pet, but your home and also yourself mentally and physically for the coming weeks after surgery. And I'm guessing that some of you might agree that, those first few days, that first week is a bit torturous. It's quite challenging, for all to adjust to. But if you're prepared ahead of time, it, kind of may make life a little bit easier. Certainly as time goes on, and knowing that you're prepared and knowing that you have that information and all the tools at your disposal, that certainly can help for those subsequent weeks. So when I think about preparing the pet, I think about kind of a dress rehearsal, really, almost like a fashion show. So getting a harness, walking them on leash, using a sling or, some type of assistive device. If they're going to wear any collar or some type of a wound garment, getting them used to those things, and, kind of introducing them to them before surgery rather than immediately after surgery when they might be more painful, more swollen, medicated. And so their behavior may be a little less, they may be a little less patient and comfortable overall. This might be a good time to do a prehab therapy session. And certainly if you're going to use a physical therapist or a rehab professional, contacting them, setting up appointments for after surgery, if not even a session before surgery. So I've seen many owners and pets before surgery, helped them to kind of set up things in the home, to fit and order devices and things to make life a little easier afterwards. Also, just introducing them to the therapy devices and toys and tools that we use can make time after surgery that much easier. Likely your surgeon or general practitioner vet is helping you to manage pain and talking to you about restricting activity to kind of keep inflammation in control and under control for those pre-op days. We want to prepare the home. So, block off stairs and furniture. Think about where your pet is going to live while they're recovering from surgery. My goal is not to isolate them 100%, but to allow them to have some stimulation socially and mentally that helps them to recover. It helps them to heal faster. So, setting up a kennel or setting up a safe area in the living room or in the kitchen where they can be safe, but also they can have some interaction with the family and see the day-to-day. Making sure that place is accessible to outdoors, it's accessible to their food and water, assuring that there's kind of a quick and safe access point to outdoors if possible. So this is a great example of kind of a safe house or a safe area for a pet after surgery. Lots and lots of rugs and yoga mats, non-skid areas, making sure that their water is in a safe area or an accessible area for them, even using a camera if you have to be away from your pet during that post-op period of time, so you can check in on them and just see that they are safe. Some pets love these little doggy beds and others find that they're very difficult to get in and out of, but giving them kind of a flat bed, a larger bed than normal so that they can stretch out, and making sure that area is restricted. So you can move furniture to kind of give them some restriction. You can use gating and fencing. You can use a kennel or a closed door, depending on what your pet is familiar with. We don't want a pet that is already anxious and stressed about being left alone to feel like they're being punished after surgery. So, kind of keeping them safe, but also keeping them comfortable and secure. One thing that I do with my clients is, I share with them kind of a checklist of home safety instructions. So, wandering around the home and looking at the checklist, seeing what doors need to be closed, what furniture needs to be moved, what needs to be blocked off to just kind of keep everything safe for the pet. Obviously, we're going to reduce some of these restrictions over time, but this is kind of the best bet for at least the first 2 weeks after surgery. And then finally, preparing yourself and preparing your family too, thinking about who's going to babysit, who's going to monitor the pet, who's going to give medications, and where will you sleep? So if your pet normally comes upstairs with you at nighttime and they sleep on a bed on the floor, if they even sleep at the foot of your bed, giving them some security and temporarily, sleeping nearby or, being accessible to them, may be a good option. I've had some owners who, go back to kind of that puppy training activity where, you have them on leash, you loop the leash around your wrist. So if you fall asleep and they're moving excessively, maybe they need to get up and go outdoors to pee or poo, you feel them tugging at the leash. Divide and conquer, elicit help from friends, from family members, do shifts and things of the sort. It might be good timing after surgery to schedule a couple days off from work or at least be accessible at home in those first few days. When we talk about prehab or that preoperative activity, this is really, it's about control and reducing anxiety and reducing stress of you and your pet for after surgery. So it gives you an opportunity to ask questions, but also to practice and prepare. Many times when we do that prehab appointment, it's very similar to our post-op physical therapy and rehab. We do find that doing prehab leads to better outcomes over time, both in human and in animal patients. And that's certainly anecdotal and based on my own experience, but, many pets who do some preoperative therapy, they do tend to recover a bit faster, use their leg faster, they regain their strength faster as well. So in order to prepare for surgery, you might want to think about kind of a shopping list. So whether you get on Amazon and throw something together, today's Prime Day, I think, order yoga mats or carpet runners, have lots of old towels or maybe like puppy piddle pads nearby just in case we need to clean things up. Your pet has an accident. The surgical incision might be a little goopy, druzy, kind of draining and maybe a little bit bloody the first few days. So, having some towels nearby can help to clean up those messes. Making sure that your pet has a harness, a sling, which we'll talk about. Hot packs and cold packs are always nice to have on hand in that therapy session. And then setting up that safe area, using an e-collar or finding an e-collar that your pet will tolerate and that you will tolerate as well, because they always will, kind of kick you in the back of your leg when they're wearing those collars. It could be a bit of a torture for you as well. So let's talk about slings and harnesses. Harnesses are great, honestly. To use a harness anytime you walk your pet, whether they've had surgery or not, it gives you better control. It's less restrictive to their airway, if they tend to pull. There are lots of great harnesses out there. Some are specific for pets with mobility issues. Some are just great little fashionable pieces. For larger dogs or medium to larger dogs, I like the Help 'em Up harness. It's a fairly extensive piece of equipment. I'll show you a picture here in a little bit. But it can be very helpful, not just for helping them indoors, but helping them on stairs, helping them in and out of the car, and for long term if their mobility becomes a problem as they age. For smaller dogs, I like non-restrictive shoulder harnesses, so that way they have full mobility through their shoulder. The Papilla harness is kind of a softer mesh harness that I do like for the little guys. They're less likely to pull in them, and it fits them very well. But there are lots of different devices online and accessible to you. If you have questions about a harness, feel free to reach out to me. Shoot me an email, send me pictures. I'm happy to kind of help you virtually with fitting a harness as well. Likely, the surgical staff will either send you home with a sling, a fairly homemade one, and one that you might use short term. You can create one on your own. You can find some slings online that can be very helpful, but there's an example there for you in the photos. Think about traveling and getting in and out of the car. So when you leave the surgical hospital, likely the surgical staff will help you get your pet into the car. But what about when you get home? How are you going to get your pet out of the car? I would say it's best to lift them carefully in and out, but that depends on your abilities as well. So I don't want to see you for physical therapy because you hurt your back carrying or lifting your dog. Teaching your pet how to use a ramp or how to use stairs to climb in and out of the car, that's great, all well and good, but don't make that post-surgical session that first time that they use a stairs or a ramp. And many times these are they're fairly expensive devices, they're bulky, they're difficult to use. Certainly use it if they're used to it, but I wouldn't recommend it if it's the first time that you've used one. Think about having someone travel with you, with your pet. So sitting with them if they're in the back seat, restraining them or restricting their mobility with like a harness or a seatbelt harness. Fold down the seat if need be. We want to be really cautious when we're driving with them so that they're safe and they don't injure themselves while we're driving, as well as when they're getting in and out of the car. Think about this also for their post-op appointments. So they may have to go back into the hospital to have their sutures or staples removed. They'll certainly have to go back to have x-rays at about 8 to 10 weeks post-op. And so we want to consider that travel in and out of the car for that reason. All right, so let's talk about surgery and rehab after surgery. I honestly think that rehab and physical therapy starts from day one. And it starts with very simple things. Many things that you can do on your own. You don't need a professional to do them for you, but it's certainly helpful to have a professional teach you what to do and help you to make sure that you're doing it correctly and safely. So many people will ask, how do I keep my pet out of trouble? How do I ensure that they're going to have a good recovery, that things are going to go well? I think the key is, follow doctor's orders, keep them safe, keep them confined, give them the medications as prescribed, ask questions if you have questions, if you either don't understand or misunderstand something, and always be more conservative and more cautious rather than more aggressive. We find that even with aggressive physical therapy, at about 6 to 12 months after surgery, most pets are doing very, very well if we follow doctor's orders, if we keep them restricted, if we give them medications. Physical therapy and rehab is going to give them a bit of an advantage to returning to normal activity again and moving more normally. It may help to reduce their pain and discomfort. It may kind of accelerate the period of time that they can get back to normal activity. But honestly, long term, they look pretty darn good regardless. All right, so post-surgically, these are some things that you're going to keep in mind, and we're gonna look at each of these kind of in a bit of detail. We want to pay attention to the surgical incision, but also think about the other tissues that have to heal. So we know that the skin is cut, the fur is cut. Your pet's going to come home, and that leg is going to be naked. It's going to look like a chicken leg. It's going to be swollen, probably bruised, maybe quite a bit red and irritated. So it's obvious that the skin needs to heal. It takes the skin about 2 to 3 weeks to heal. And then we have the tissues that are underneath the skin. So we have fascia, we have the joint capsule, which is connective tissue that surrounds the joint. We have muscle that has atrophied. We have bone that needs to heal. We have the articular cartilage, the meniscus inside the knee that needs to heal. When caring for the pet at home, especially early on, we need to take care of that incision. We want it to be clean. We want it to be dry. There may be some drainage, and it should be clear or maybe bloody, but that drainage should be done in a few days. We never want that drainage to be oozing or pussy or open. We don't want the incision or the knee to be bright red. It's fairly normal for there to be bruising and swelling, and many times it's worse at about 2 to 3 days, maybe even 4 or 5 days after surgery. Because the pet is standing or even lying down, they're not lying with their leg elevated. That swelling kind of accumulates down into the ankle and into the foot. So it actually looks worse before it gets better. It turns all kinds of beautiful colors, but we want to just keep an eye on that incision and make sure that things are healing well. It's great that we have these cameras on our phones. It's easy if you can't see the incision yourself, just aim your camera underneath your pet and, take a quick picture of that incision, and that'll give you some feedback as to how things are going. Pain management is also key early on after surgery. We certainly are giving our pet medications in the short term to help them with pain. We don't give NSAIDs or pain medications long term because this can get in the way of the healing process. We might use ice and heat for pain management, less for management of inflammation, and less long-term than short-term. Massage is key. Movement is super important. And we can use some physical therapy modalities, laser therapy, electromagnetic field therapy, and even electrical stimulation to help our patients manage their pain. Usually, though, I would say that once we're out of that first week or two, many of our pets who have had this surgery are actually less painful than they were before surgery. So the bigger challenge is going to be keeping them restricted so that they don't injure themselves and slow the healing process. So I can't emphasize enough how important it is to touch our pets and to interact with them socially after surgery. Reintroducing touch is a positive thing. Sometimes even in areas away from the incision, we're so concerned about the knee, about the stifle and that incisional area that we want to kind of take a peek and touch it and, move the leg around. But it's really important to emphasize that positive touch, scratching them on their heads, rubbing their backs, kind of giving them that interaction in a positive way, reassuring them that they're going to be okay over time. And massage is super important as well. So massage is great because it helps release endorphins, so it can help to manage pain. It can help to mobilize or reduce inflammation by increasing circulation. It can help to get those joints moving a little bit faster and a little bit easier because that inflammation is being kind of flushed out of the system. So, I think overall, my lesson to you, if you take anything away from our session today, is to make sure that you put your hands on your pup. After surgery, touch them on the head, rub their backs and necks and shoulders, give them lots of love. Massage is really heavy petting, so it's petting with a purpose. And many times we find that there are areas of their body that compensate that can become painful and uncomfortable. So their neck, their shoulders, their back, and their hips are areas that I emphasize when I'm doing massage. We might do massage at the end of the day, kind of as a wind down from the day, or you might do it after they've warmed up a bit. So we might use heat to warm them up, or we might just take them on a short little leash walk to warm them up. I like to do massage before doing range of motion, and we'll get to that here in a second. All right, so here's a great picture of a homemade sling. So a sling, or a belly sling, made out of a canvas shopping bag. So if you notice the handles here, and that shopping bag was basically cut at the seam all the way down. So it creates this like nice little sling that can be put under your pet's belly. Now, obviously, we can use the sling to help them walk on the floors at home, up and down whatever stairs they need to do to get in and out of the house. And many times once we get our pet to a safe area, we can release the sling, let them pee and poo on their own, but give them that sling support to help them with their mobility. If you think about it, using a sling like this is like us using crutches, a walker, or a cane. So it's an assistive device. We're unweighting their body a little bit, giving them some support and some help with their mobility. So after surgery, certainly we want to give them some support and start to reintroduce leash walking. In general, I would suggest doing leash walks maybe for 5 minutes, increasing by 5 minutes each week after surgery. So that first week, they're probably going outside, going potty, coming back inside. That second week, we might add a few minutes. After that, we're adding 5 minutes basically each week to each of their walks. We can use a leash, we can use a harness, we can use a sling to give them some support. And this image here is actually of that Help Them Up harness. So you can see it's actually a two-part harness where you have a shoulder harness with this chest piece and kind of a little handle up top over their shoulder blades. And then that attaches to the second piece, which is attached over the pelvis, with a strap that goes kind of through the thigh and attaches in the back and then around the other way. So this kind of makes your dog into a little bit of a suitcase. So you have two handles. You can give them more support in the back or more support in the front, depending on how you need to move them. Roughwear also makes some great harnesses. They're climbing harnesses basically, but give pets quite a bit of support. The Help Them Up is really very helpful for pet dogs, especially Labrador size or bigger, to help us to help them in a safe way for us and for them. But as we're starting back with leash walks, you think about you're supporting your pet. You're not carrying them. You're not unweighting them completely. We actually want them to weight bear and use the leg while they walk. But we don't want them to use it so much that it is uncomfortable, that it slows the healing process, that it's painful for them. You're going to progress from using the sling to using just a harness and a leash, and then finally returning them to their normal activity, whether they do off-leash activity or not. We want them to weight bear as tolerated, and certainly be aware of your own body mechanics and safety for yourself too. With regards to post-surgical rehab and physical therapy, it's very individualized for each pet. But in general, we're looking at kind of a warm-up, doing some massage or some manual therapy, some passive range of motion, and a cool down, and then rest. So this is immediately after surgery. We're going to keep it very, very simple. This image here is actually of a home exercise program, probably more appropriate for a pet 2 to 4 weeks post-surgery. You know, using unstable surfaces, maybe sit to stands, maybe backing up, other activities and exercises specific for that pet, based on their issues and their pet owner's concerns after surgery. But very early on, we're going to keep it super basic. So not a lot of specific exercises, but really focusing on the healing process, focusing on keeping them comfortable, and getting them moving again. So I'll share with you a little bit of information about heat and ice. You know, there's a bit of confusion on it, and what does what. Honestly, both increase circulation, both reduce pain, both can reduce swelling. Likely you're going to use heat in the more chronic or long-term stages, if at all. And likely over soft tissues, so muscles rather than over a joint. You know, we can use it to help to dissipate bruising and inflammation or swelling, but likely we're not going to use a lot of heat kind of in our normal or standard rehab. Passive range of motion is super important. We want to return our pet to normal range of motion. You know, the joints are going to move well. It's the soft tissues, the muscles that are probably going to restrict our pet's motion. And I'm going to share with you a couple of videos with regards to range of motion and how to do it in different occasions. Again, every pet is different. They have different sizes, different tolerances of handling. In general, you want to pay attention to your position, but you're going to be close to your pet. You want your hands to be relaxed. Keep them close to the joint that you're doing range of motion on. And basically your job is to flex and extend each of those joints. So the hip, the knee, and the ankle. We might do range of motion anywhere from 10 to 25 repetitions a couple of times a day, and we're keeping it comfortable for our pet. So they may not have full range of motion initially, but over a period of time, we're going to find that that range of motion actually increases, especially as the inflammation and swelling goes away. All right, so here are a couple videos for you in some different positions. So looking at the hip, which is the joint really close to the body. My dog is not very tolerant of hip range of motion, but you can see how we're using a little bit of massage and rubbing to get her to extend or straighten the hip, and then letting her actively flex the hip. You know, some pets don't like to lie down for range of motion, so we might do it in a standing position. So we're going to extend the hip and flex the hip. Nice and gentle. We're not forcing anything. It's not a tug of war game, but we're going through that available range of motion or that tolerable range of motion as we're able. And to the stifle or the knee, flexing and extending again. So keeping our hands close to the joint, bringing the heel towards the hip, and then extending and reaching it away. And then you can see here doing the same in a standing position, bringing the heel towards the hip, and then extending it back out. So nice and gentle. Good. And then the tarsus or the ankle, we're just going to flex and extend. Now it's best to do this when the hip and the knee are already flexed. The Achilles tendon can restrict that range of motion. And again, in standing, we're just flexing and extending. So the order that we do range of motion in is more dependent on your pet's tolerance and comfort. I wouldn't get too terribly concerned about it. But if you do range of motion at the ankle and then the knee and then the hip, you're actually helping to flush or push that inflammation back into circulation. So that would be the ideal method, but certainly not necessary. All right, so when your pet does not cooperate with range of motion, this is my own dog who is the worst patient. You know, we give them lots of loving, and, lots of belly rubs, and try to distract them from that range of motion and see what we can get. So sometimes letting them do their own range of motion a little more actively rather than passively can accomplish a lot of the same things. And to be honest with you, it's all about managing their pain and comfort so that they can move normally again. Less about us forcing that. And then I promised I was going to talk to you a little bit about ice, so we might use ice after activity, after doing range of motion. Again, ice, just like heat, is going to help to reduce pain. It's going to help to reduce inflammation. It is going to increase circulation to the area as well. And we usually use ice immediately after surgery for a few days, and then sometimes after exercise or after physical therapy to kind of calm things down a bit. But we do find that too much ice can actually slow the healing process, so we don't want to overdo it. And to be honest with you, if your pet is not a huge fan of heat or of ice, then it's okay. I would not force it. Hurting them, or, having an accident where they're kind of running away or jumping away because they don't love the ice or they don't love the heat is really not worthwhile. When using ice or heat, definitely use like a towel or a bed sheet between their skin and that ice or heat product. We don't want to burn them. We don't want it to be uncomfortable, and we don't want to introduce any bacteria to the incision. We don't need an infection. So don't lose sleep over heating and icing your dog's knee. That's basically my lesson for you. And to just kind of catch up with the Joneses, really, with regards to heat and ice. In sports medicine and orthopedics, we're really not doing RICE anymore, which is rest, ice, compression, and elevation, but we're using peace and love. So we're thinking about protecting the joint, protecting the surgery site, protecting the injury, elevating if we can. So that's going to be a bit of rest for our pet. We're avoiding anti-inflammatories and ice really in the long term. We're applying compression if we can, which is difficult with our pets, but we can with our hands. We're educating our pet owners, we're educating ourselves, we're allowing them to load or use the limb. We're using optimism and trying to keep things really positive. And then we're using exercise, and exercise is really key with regards to return to activity. All right, so to go through, let's look at that first week. So with ice and heat, we tend to use ice those first maybe 3 days or so, and we tend to use heat more in that chronic stage, if at all. We might schedule a prehab or a pre-op therapy session before surgery. That passive range of motion should really start day one. So some type of range of motion, whether it's active or passive. Our focus in that early stage is to reduce pain and inflammation, redness and swelling, and we're hoping to increase their appetite, their leg movement, their weight bearing, and just general use of their limb, as they're moving and walking. We're always, throughout their recovery process, always every day doing some kind of massage or some type of hands-on therapy and doing some walking with support. All right. So let's talk about what I do, what my colleagues do, and how to hook you up with a therapist in your neighborhood. I think I already answered this question. When do we start PT? Immediately, first day. And you're the PT. You might not have a degree or a license in physical therapy, but by putting your hands on, by doing these post-op activities, you're rehabbing your pet. It's never too late to start physical therapy. So if you're not starting day one and your surgeon would prefer you start at day 14 or month 1 or month 2, it's totally fine. We can start at that point in time. We really evaluate the pet as an individual and look at their needs and your needs with regards to physical therapy and getting them back to moving as normally and comfortably as possible. So it's a little overwhelming when you start to look at animal physical therapy or canine physical therapy and rehab. It's the Wild West, we call it, and it has been for a long period of time. But there are providers of physical therapy and rehab for pets who have varied backgrounds. There may be veterinarians, they may be physical therapists, they may be veterinary nurses or technicians. Even here in Massachusetts, we have nurses, we have massage therapists and myotherapists, we have animal trainers, all different kinds of credentials and backgrounds. What I would suggest is that you look for someone who has a license, someone who has a certification, and someone who is insured. So they should carry some liability or professional or business insurance as well. And you should ask them for, to see that documentation, certainly. Certification, there are tons of different ones. This is where we are here in the US. Overseas, there are master's degrees in animal physical therapy. We do not have that here, but we do have certifications from a variety of different organizations. I would ask for recommendations. So ask your vet, ask your surgeon who they recommend, who's in your area. And when you talk to that therapist or that rehab provider, ask them about their experience, ask about their certification, their licensure, their insurance, but also what tools and toys do they have, what knowledge and skills do they have. We can get overwhelmed with the tools and the toys, the bells and the whistles, and they can be very helpful, but they're absolutely not necessary for rehab. If you think about it, rehab is every day as you interact with your pet. Water therapy is wonderful, but not a necessity after surgery. All right. So I provide in-home physical therapy and rehab. I used to work in a specialty center here in Massachusetts and also in Maryland, which was fantastic and fascinating. And I learned a ton, but I find that pets are really less anxious. They're less stressed. They're more comfortable at home. We have better control over what they do and what they're able to do. They tend to respond better at home. And this is a real world application. So when we practice stair climbing, we're doing it on their stairs. When we practice getting in and out of the car, or in or out of bed, or whatever that might be, walking in the yard, going to the dog park, this is the real world. So I do find that in-home therapy is very rewarding and very helpful, especially early in that acute stage. And we are very lucky that we have quite a few practitioners who do provide in-home therapy. I mean, this saves you time and energy and traveling to and fro as well. In-clinic physical therapy and rehab, it can be certainly beneficial as well. There's the opportunity to have more bells and whistles and tools and toys, water therapy, all the things. I basically take into the home what I can carry, what I can fit into the back of my Subaru. And some of the clinics that offer physical therapy and rehab, they have all kinds of toys and tools and things, and it's a fantastic and fun place, but it's got to be right for you and for your pet. Again, we're really lucky in our area. We have lots of different providers. Susie Starr is there in Natick. Dr. Stroud is in Waltham. But Dane and myself and Jody and Bob and Catherine all do in-home therapy. We all do home visits in different areas of Massachusetts. Jen Lyons has a facility kind of north, as does Louis Carrillo. Linda Rogers works out of IHC in Bolton. So we do kind of cover the gamut. I will dare say, though, that even though we have so many providers, it's sometimes difficult to get an appointment right away. So definitely reach out ahead of time, you know, and be prepared to be, you know, somewhat flexible with your schedule. Is water therapy necessary? You know, I think I already answered that question too. No, not necessary, but sure is a lot of fun for the pet who likes the water. You know, we don't want to do any water therapy until after the incision is closed or sealed. That's usually at about 14 days post-op. We don't want to do swimming until the surgeon permits it. And that includes, you know, swimming in a pool versus swimming in a pond or a lake or at the ocean. Usually not until after the radiographs show healing. So that's at anywhere from 8 to 12 weeks post-op. Both are very beneficial to our pets, but certainly it's not something that I would introduce to a pet who does not like water. So underwater treadmills are amazing and so much fun to kind of see how the pet is moving in the water. You know, there are more underwater treadmills for dogs than there are for people in the United States. You know, it's a great type of therapy, certainly. Here's a little video for you showing kind of this a border collie kind of sporting dog as she's rehabbing from left leg injury. She did not have surgery, but she had a neurological injury. And what you should expect is that the therapist or the rehab provider is getting in the water with your pet, you know, giving them some support, you know, helping them to move as normally as possible in the water. The water with the buoyancy allows them to weight bear a little earlier, but it also exaggerates the range of motion, so that's another method by which we can increase the range of motion. Now, swimming is awesome too, but you'll notice, kind of paying attention to biomechanics, you know, pets float really well, whether they have a vest on or not. And many times they don't really go through a normal range of motion. So this dog, a Labrador, doesn't extend his hips when he's swimming. And that's not unusual. You know, we call doggy paddle for a reason. You know, so it's a great activity for pets with osteoarthritis because they can move and work on their endurance and their strength in a non-weight bearing environment, but maybe not the best option for after surgery. Now, I would say that any or all of the therapists that I listed previously have access to what we call photobiomodulation or laser therapy. You know, this is something that we don't see enough in human physical therapy, I would say, for many reasons. But we use light, and specifically infrared light, to help to stimulate healing. So the light is absorbed by the cell membrane, it's absorbed by the mitochondria. It kind of stimulates those processes, it flushes out the inflammation, it can help to relieve pain, and it can certainly help to speed the healing process. It is not intended to produce heat, it is not a surgical laser, but a class 3 or a class 4 laser. Manual therapy is kind of professional massage. So this is at a higher level, a more specific level. It's skilled movement of bony or soft tissues. This is similar to chiropractic or osteopathic technique. Physical therapists also do manual therapy, massage therapists do manual therapy, and this can help a pet that is having difficulty with restrictions or maybe substitutions or compensations as they're returning to activity, and help them to move more normally again. And then therapeutic exercise, this is really your job. You know, we're going to teach you exercises that your pet can do to get strong again, to move normally again. Many of these exercises might resemble normal functional activities, like going from sitting to standing, or backing up, or crawling, or turning in circles, stepping over hurdles, all these things, but with a very specific purpose. All right, so let's talk quickly about the goals of physical therapy and rehab. not just to get our pet back on their feet again, but to help with the healing process and to help the muscle heal and to reverse that atrophy that they have. So after injury, after surgery, the nerves kind of shut off to those muscles, and the muscles get very weak and they atrophy and they shrink. As we reactivate the muscle, as we remove that inflammation, as the pet uses the leg more normally again, that muscle can hypertrophy or get stronger again. So this is like going to the gym and lifting weights. So we have to overload the muscle so that it gets stronger again. But we don't want to overload too much too fast, because that'll slow the healing process, and it will make it more difficult for them to get back to normal activity again. So in general, kind of our short-term goals, and you may understand this after our discussion here, our first goal is to manage pain. Our second is to resolve or reduce that inflammation. We want to encourage weight bearing or use of the leg. We want to restore range of motion and finally build strength. And then long-term, we're focusing more on function. So getting that muscle back, moving and posturing symmetrically, climbing stairs, excuse me, going to off leash, building endurance, returning to training, work and sport. And in physical therapy, we may talk about tolerance or resilience. So we want the pet to be able to use their leg, to move their body normally, even after we stress those tissues and stress those muscles. So we don't want them to have what we call DOMS, or delayed onset muscle soreness. We don't want them to be painful after therapy or after exercise. We don't want them to be lame or limping. So we hope that every pet gets to this point. Certainly, excuse me, physical therapy can help you with that and help you with kind of titrating, engaging the level of activity that's appropriate for them at whatever stage they are in their recovery. So in general, kind of this is our timeline. We have that prehab, that surgery date. We may be doing, more intensive physical therapy in those first few months, kind of working towards leash walking and stair climbing. But at that 6-month point, our pet is likely playing again, they're running and jumping again, they're returning to more normal activity again. So these are, our hopeful outcomes. We want to improve their quality of life. We want them to return to their normal activity, certainly once again, after surgery. And so just to kind of wind things up for you, just to let you know also, those first few weeks can be a bit of a challenge and a struggle. And it's also sometimes very hard to find a therapist who's available to help. So I put together kind of a 2-week course for pet owners. It's called the Canine Cruciate Kickstart. You can find it on my Teachable page. There's a link there for you. If you have questions, certainly reach out to me. I'm happy to collaborate with you online or in person, or to hook you up with a therapist in your area. Feel free to reach out to me by email. Certainly through my website, through social media, or through Teachable. And again, there is someone in your neck of the woods, who can come visit you, or who is nearby, where you can go and take your pet for physical therapy. But, much of this is stuff that you can do at home. We're here to support you and to help you, and to hopefully, reduce the potential that you're overwhelmed by the whole process. They will get back on their feet again. And that's really what this team is all about. So from surgery to the medical staff, to the physical therapy staff, and certainly you, your friends, and your family too. So I am happy to, answer any questions. I know Ekta needed to sign off, but I'm glad that she was able to join us. Any questions, any concerns, any thoughts, feel free to unmute yourself if you'd like.
Well, no questions. I just, I'm glad that you said you'd be recording this, because I really hope Donna gets a chance to see it. Well, it's a lot. and I hope Donna gets a chance to see it and stuff
Yeah,
too.
I'm
So
very, very happy to share with her. So what I usually do is I'll take the recording and I'll send the recording to the staff at Boston West, and they can share that with you by email. If you have difficulty getting that from them, feel free to email me directly and I can just send you guys a link. So, and you said your pet is having surgery next week, the 22nd?
yes, 22nd. So
Okay.
gotta start working on the
Yeah, no,
spring
I
and
mean
stuff.
it's actually good timing because it'll be somewhat fresh in your mind still.
Mhm.
And yeah, and you have a couple days, certainly to get things in order. And two, this might create more questions in your mind for your surgeon and for the nursing staff too. So yeah, so
Yeah.
feel free to, jot your questions down and reach out, whether to me or to them, anywhere along the lines. But it's not an easy road, but honestly, like understanding the whole process and the healing process and and what is expected, that will help. And seeing the process and the progress every day will help too. So
Good,
I
yeah.
think the key is, not to stress and try to, keep things as controlled as possible.
Well, that's
Most
it. It's
flexible for you. Yeah.
containment's going to be the biggest issue. I think she's
I
very
hear ya.
active.
I hear ya.
So
That is probably the biggest challenge. And you know what, if that's an issue for your pet too, you can talk to the surgical staff about, prescribing a medication or a sedative or something like that to kind of keep your pet calm and relaxed. Just like though with you or with if we go and exercise really hard, likely we're going to sleep better. Not that you're going to exercise your pet really hard, but likely they're
yeah,
going to sleep really well,
I'm
when you're
done.
getting back to that normal activity again. So yeah, so feel free to reach out if you have any questions at all. And I'll certainly share the link with
Will
you and
do.
Donna.
Okay. Well, thanks a lot, and
You're very
we'll be
welcome.
looking for that, and looking forward to getting it done.
I know, get it
So,
done, get past that first week and you'll be home free. So
right,
great to speak with you, Dan. Take care
right.
and good luck.
Thanks.
All
Yep.
right.
Good
See
luck
you.
to you.
Bye.
Thank you much. Bye now.